This Week in Richmond is made possible in part by the Virginia Education Association. An investment in teachers today will pay dividends tomorrow. Dignity Memorial. The Dignity Network provides professional and compassionate funeral, memorial, cremation, and cemetery services throughout the Commonwealth of Virginia. Virginia Hospital and Healthcare Association for jobs, the economy, and public health. Committed to advancing health and economic opportunity for all Virginians. Virginia Tourism Corporation, promoting why Virginia is for lovers. Lovers of wine and craft beers, the outdoors, beaches, history, music, and more. Fall in love with Virginia at virginia.org. Additional support provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond, and a very special welcome to Jim Rothrock.
Thank you.
Appreciate your being here, Commissioner for the Department for the Aging and Rehabilitative Services.
There we go.
I said of the aging one time when we had a
and
conversation.
actually, there's no "the" in it either. So it's Department for Aging and Rehabilitative Services.
Oh, so no E. Okay.
No E, no.
All right. Jim, very much like to talk to you about how you have juggled things over the years, working in various administrations, and you've had a long career. You've had a time when two departments were merged.
Yeah, right.
Into one. So let's have you tell our folks some about that.
Well, it's interesting in retrospect, and again, I've served 5 governors and several others before as a deputy. And started in the early 80s with parallel to the Robb administration on the Virginians with Disabilities Act. And the big issues then were handicap parking and access to buildings.
Yes.
If you think about Maslow's hierarchy, it was very basic stuff. And now to see us talking more about things like inclusion and self-determination and competitive employment for people who historically have been in sheltered employment, but with technology and job coaching, they can do very well in integrated employment in the community. It's been a real opportunity to see a real swing in priorities, and people with disabilities are becoming more included in the Commonwealth, yet there's still some ways to go. It ain't perfect yet, for sure.
And then the additional hat that you started wearing and combined was that Department for Aging.
When aging, but it is interesting because there's a common thread that there are lots of Virginians who have some degree of need to stay in their community, whether they have a brain injury, whether they have cerebral palsy, whether they have early onset dementia, whether they have some of the disabilities associated with just the typical aging process. The common theme is they all want to choose the life that they wish to lead, many times in their home. And it used to be that they were shipped into a nursing home or into an institution. Now we have made huge progress in just not doing that and trying to work with them to keep them in their homes.
And so that's, as you were describing it, it's not simply those who have sort of unique needs, or just for aging in general.
Right. It's not so much as the diagnostic or the eligibility criteria that has heretofore been very strict. It's getting rid of that and really looking at the individual's needs and cobbling the services that they might need to thrive in the community, as opposed to saying, well, no, you're not old enough, or you were injured after your 22nd birthday, or you're not severely disabled enough. You know, we've hopefully made progress in getting beyond that.
I think it's somewhat unique, and I wonder if you think that too, because so often people think, whether it's federal level or state level, government keeps expanding and new agencies, new departments. this was pulling together two different programs.
Pulling together
into one.
Yeah, and several different programs. We've also got our ombudsing program for individuals in the nursing home, and now in communities who have questions about managed care and might need an advocate or someone to explain it to them. Adult Protective Services is under our portfolio, and we continue to see that financial exploitation is just, the trend line is way too severe, and we need to work on that. So again, we can put together whatever individuals need to stop a negative behavior, and then hopefully blend in the services that they need where they can have the life that they would like to have, just like you and me and everybody else.
Right. Well, 5 different governors.
Yes, I was with the protection advocacy in the state with Governor Wilder, and wandered in the wilderness for the Allen and Gilmore administrations, doing lobbying and organization management. Really a great time there. Worked with Mark Warner on his governor's campaign and developed some policy papers for him, and then followed with Governor Kane, and was fortunate to be held over. Bill Hazel, Secretary of Health and Human Resources, wanted to keep agency heads from the Kane administration to try to continue with the continuity. And we didn't have, although we had a change in parties, there was not a huge change in emphasis. And then with Governor McAuliffe, he was kind enough to keep me on, as Dr. Hazel stayed on also. So I've been fortunate to go through those 5, and then did work with Rob and Bilal's, and then some work with the Gilmore and Allen administration. So I've had my fingers in a lot of different little.
More than 5.
Yeah, well, yeah, actually.
You add those up.
Yeah.
Far more than 5.
Yeah.
Jim, let me put you on the spot. What, as you look over that long career that still continues, what are you most proud of that really got accomplished? And not putting you completely on the spot to say you did it all on your own necessarily, but what was one of the biggest?
Yeah, I haven't really done much.
Oh, no.
But no, I could have screwed a lot of things up that I didn't. I think being able to keep the ebb and flow of politics, with a capital P, out of the day-to-day operations of the agency and the programs has been one of the proudest accomplishments. Seeing that program momentum continues, even when you've got a change in administrations, even when you've got a budget deficit or a budget increase, there's a certain momentum that has been kept moving, and I think that's something that I'm very proud of, to see that's been sustained.
Well, that's significant.
Yeah.
That's significant, because you and I could tell the war stories of agencies and all that where the politics just ran rampant.
Oh, yeah.
And then the ebb and flow with governors changing.
Right.
That's major to keep that out.
There were 5 governors, 5 agency heads from my agency during the 8 prior years to me coming on, and then having the same person for 16 years. It's not necessarily so much about me, but having that stable leadership has been really helpful to the people that are in our Danville office and our aging agencies in Alexandria. You know, it does mean some stability helps them do their tough jobs a little bit better.
What do you see as some of the big challenges facing the agency in the coming years?
There's still, funding is always a problem, and regardless of funding, making the community's attitudes about aging and disability more favorable. Again, the biggest barrier to people with aging and people with disabilities is found between 2 points, and those 2 points are A and B right here. It's the manner in which we think about the aging process. It's the manner in which we think about a person with a disability. And we too often shove them in niche and say, and determine everything that we can do about defining them as their disability or aging, when they're really much more in common with us, and being able to keep that mental rehabilitation and attitude adjustment going is going to be the key toward the future.
Coming up on toward the end of 2017, here in November, it's National Family Caregivers Month throughout the nation. I think that caregivers certainly are important, whether it's November when they're recognized or throughout the year.
Well, you know, we did a study several years ago that showed that in the Commonwealth, we realized a $2 billion savings in care that is provided by family, unpaid care that is provided by family members.
What was that?
$2 billion.
$2 billion.
And our agency does some respite programming, some training of caregivers, anything we can do to help them keep that job. For fiscal reasons, we can't afford to come up with $2 billion of services from some other entity, and it's the right thing to do. And we're committed to keeping people in their families, and many times committed to keeping people in their homes, and many times family members are the key to that.
Jim, you've had lots of staffers that have worked with you. Have you had continuity there that's really been helpful, or you've probably trained a lot of people that they've moved on to other positions?
Well, again, one of the things we're doing this week, in fact, is working with some of our new managers. It's a program called Skills for Leadership, and we take emerging managers in our program, give them 360 evaluations, bring in Bill Leidy to talk to them about leadership, and make them ready for the future. And we're seeing that that program, unfortunately, it didn't have anything to do with me. They started long before I came on, but that has really sustained a flow of trained managers that are on the bench, that as the time arises, they can rise to a higher level and provide leadership as we hope they would.
Jim, what's some closing words you'd like to give folks?
Again, we're all going to hopefully age, and about 20% of us might be disabled. So begin thinking about those issues now and preparing ourselves for that in the future, because it's a reality.
Jim, Commissioner and friend, Department of Aging and Rehabilitative Services, thank you very much for being on This Week in Richmond. Thank you. Welcome to This Week in Richmond, and a very special welcome to Debbie Johnston.
Hello.
Just glad to have you here. Virginia's adoption champion since 2014.
Yes.
When appointed by Governor McAuliffe to take some leadership in the private sector and see what could be done about so many children and actually some young people needing to be adopted. So we talked, it's been a couple of years or more since we've talked about the adoption issue. So what's the status report, you might say, right now? How's it going?
Well, I am very proud of what we as a state have accomplished this year. We had our highest number of children adopted ever in the state, 747, like a jet. So
747?
747. Yeah. It's been sort of a slow decline and a learning process for me, and we're just getting better and better. When they asked me to do this, I had no clue what I was doing. So I read Dave Thomas's book, you know, Dave Thomas that started Wendy's. Remarkable book, made me cry. But President Bush asked him to be a champion. So I just thought, I'll just do whatever he did. And what he did was he went out and just started talking about adoption. So I attribute what we've done to improve is by awareness. My goal was, let us talk about kids as much as we do dogs and cats, because we do really well with that. And I don't know if you've noticed, but there's billboards now. I have 2 TV stations that, and this is National Adoption Month, feature a child a day to tell their story. I have Luann Tooley, who wrote The Blind Side, pitching in. She's featuring kids. So we've made some really good headway on this. And our state has improved with different processes. We're better about getting home studies done. So a lot of things to be excited about.
You know, I think it's pretty exciting that as I talk with Jim Rothrock and now with you, National Caregivers Month and National Adoption.
It's the same.
Yes, yes. That 2 different parts of the same issue in some ways that need to be addressed.
Yes.
And I would think the adoption part has got to be a challenge, because even as you get a record 747, there are other babies and children coming along and needing adoption. And so it's you know, we've talked in some other programs about veterans homelessness.
Yeah.
And as soon as they get the veterans all set, then there's some others that become homeless. And I was thinking on the adoption part, that's a constant issue, because
it is.
One person gets adopted, another baby's born needing to be adopted.
Yes. The opiate crisis has really affected the number of infants that we have in the system. We now have infants because more infants because as I go around and speak at different places, I'm always curious as to why a child is in the system. And I went to something in Norfolk, and by the way, they have the greatest results of adoption in the state. And they told me this child is here because of opiates. So if you want an infant, we have more infants, and it's a constant cycle of children coming in, and that is playing a big part. So you got 2 problems to fix, and I don't know how to fix that opiate crisis. It's really devastating.
Oh, it's certainly, I think, unlike anything that we've had to address as a nation before. I mean, it makes the marijuana and the other things so mild in a way in comparison.
Yes, it does. And it creates more need, because the way it works, if the state has one of your children in care and then you have an infant, they immediately take that infant, and they kind of have to. You know, kids don't ask to be in this situation.
Yeah.
And I'm just a firm believer, because I read it in People magazine about a little boy that went to a church, and he told a story, and he did it on video. He put it on Facebook. It went viral. 10,000 parents stepped forward. So it's not that we don't have people that want to do it. If they know about the child and the child can tell the story, parents will come up.
Yeah, so part of the work as a champion is getting that story told, and we hope that as people are watching This Week in Richmond, there's potential parents who are watching right now.
Yes. Channel 6 hosts this for me every year. Media has been more than kind. If you ask, they give, and I've had several of them give time. I've had radio people give time. So awareness has been my thing, and I think we've made a lot of progress.
We're going to have a couple of different web addresses up as we're talking. One is one where they can get more information about the work you're doing. The other is really the social services site also. And people will learn, even as I did, that there's 2 different kinds of adoption. There's some that goes through an agency, then there's other private adoptions that take place. And so there's 2 different tracks, at least 2 different ways that people can step forward and help with the children.
And there are many moving parts. You know, there's social workers that come and get children. There's foster parents that house children for a while. There are judges. I went to Adoption Day in Fredericksburg, where there were 3 judges, and about 15 kids were getting adopted in one day. And So there are many people that make this work. And I applaud them all because it's hard work. And you hear every story that you can imagine. Every time I think I've heard every story.
Right.
Here's one more.
If someone is considering it but not sure they're ready, is being a foster parent a good step
Yes.
to take?
Yes. And actually, unless parental rights have been given up, foster parent, you have to be a foster parent for a year with a child. We have 4,000 foster kids right now. And that number moves all the time. And some of the parents will get better and get their children back. Some won't, but it's a definite system, and we need foster parents, and anybody can do it.
A single person can,
Mm-hmm.
a couple. It's not age related in any way.
Right. I had a beautiful grandmother. She helped raise 4 generations of kids. And I have a picture of her when she's 94 swinging in a swing. And I'm positive that kids kept her young. The anti-aging.
Yes. Now you mentioned the founder of Wendy's and his request by President Bush. So why would the governor, what's interesting about your background that the governor would ask you to be the adoption champion?
Because I'm adopted,
Yeah.
so I can really.
I wanted you to tell our viewers that, because some who don't know you, you hadn't really said that.
Yes, when I was 3, I ended up with a large family, 5 siblings, and we are like Italians, lots of love, and then there's days, but it's good. So I'm one of the lucky ones.
Right.
I want all these kids to be as lucky as me and have a permanent loving home.
Well, it's a chance for you to certainly to serve in a volunteer capacity and to give back, and to, in that sense, to help others who are not getting that right now, who don't have that same benefit that you had.
Right. And I think it's just because people don't know about these kids. I really do. Because when we tell their story, things happen.
Yeah. If something happens and there's danger, a child maybe has been taken, we have Amber alerts and we're alerted. It's almost like we need to have a foster parent or an adoption alert that goes out that because people respond to Amber alerts.
Yes, what a brilliant idea.
They respond.
What a brilliant idea.
Yeah, some way to send out an alert that there's a need, and someone's bound to be there and will respond. I heard just this month of someone responding to a 17-year-old who was living on the streets because her mother kicked her out, and she had one more semester of high school, and people in the community just took her in. Said, you've got a home. Your mother kicked you out, you got a home, you need to finish high school.
Maybe we should start a I need help page.
Yeah. Yes. Yes. Well, I think that with the work that you've done in your career professionally and in volunteer work, then you've got the ideas. You just need to get more people to become adoption champions also, because everyone who adopts is an adoption champion.
Yes, they are. Yes, they absolutely are.
And while this month of November we're giving thanks for and Thanksgiving for those who adopt, December and January and February, every month can be a month with more adoptions, more foster parents stepping up.
Yes. I love your idea.
Yes. Well, we'll
Foster
work on
alert.
it. Yes. Well, I think our time has run out, but we hope that people will get involved, and we thank you, Debbie Johnston, for what you've done and what you're doing as the adoption champion. Thank you.
Thank you, David, for having me on the show.
Thank you.
This Week in Richmond is made possible in part by the Virginia Education Association. An investment in teachers today will pay dividends tomorrow. Dignity Memorial. The Dignity Network provides professional and compassionate funeral, memorial, cremation, and cemetery services throughout the Commonwealth of Virginia. Virginia Hospital and Healthcare Association for jobs, the economy, and public health. Virginia Tourism Corporation, promoting why Virginia is for lovers, lovers of wine and craft beers, the outdoors, beaches, history, music, and more. Fall in love with Virginia at virginia.org. Additional support provided by these sponsors. And by the members of Virginia's public television stations. Thank you.